Hey, what's up everybody? Dr. Ryan Weaver here with Apex Spinal Performance. We're going to be going over today's spinal workshop. Today we're going to be talking about the topic called fibromyalgia. Fibromyalgia is a very prevalent diagnosis. 12% of the entire U.S. population has experienced this. That was from a 2018 study. But before I dive into, what is fibromyalgia? Is it a real thing? It's not well understood. It depends on who you ask in the medical community, in the healthcare community, and a lot of varying theories on this. But before we get to that, do us a favor, subscribe to our YouTube channel, subscribe to our, or set your alerts on Facebook so you get notified when we post content such as these spinal workshops, other fun facts, and why we do these spinal workshops again is we believe here at Apex that the most important thing we can do for you is educate you. That is second to adjustments, and a well-educated patient, a well-educated community makes healthier decisions. I really haven't referenced it much this year, but all of last year we talked about that Duke University study of poorly made choices is the #1 cause of death in our country. So being educated to make the healthier decisions and also knowing what your options are. So that is, again, something that we're going to discuss. When we talk about certain symptoms or diagnoses such as headaches last week, fibromyalgia this week, with those certain topics, we will discuss some of the options that you have besides medications, injections, and surgeries, and things of the such. So let's get started on this. Fibromyalgia is a syndrome, obviously, resulting in a long-lasting, sometimes debilitating muscle pain and fatigue. Now, when this starts off, fibromyalgia actually starts in the muscles, not necessarily in the joints. Half of the people who have been diagnosed with fibromyalgia have a difficulty in performing daily tasks. One of the fascinating things that I find about this is the cyclical circle, hole that we go down through here, the funnel that we go through of what happens to our body, why it happens, and how we go from maybe bright-eyed, energetic, and bushy-tailed to a couch potato, depressed, doom and gloom, and really not able to function and move. So 30 to 40% of people had to actually quit their job because of fibromyalgia. So some of the things that we're going to talk about, again, if you don't have this or if you have been diagnosed with it, the better you are prior to this, which if you've heard or listened to any of our other prior spinal workshops, really if we strengthen our host, aka our body and our systems, we can really go through battle a lot better than if we're really ill, we have maybe a few comorbidities. It's harder for us to thrive in certain scenarios. So people with fibromyalgia, this was from a 2006 Journal of Clinical Rheumatology study. People with fibromyalgia are 2 to 7 times more likely to have depression and anxiety, headaches, irritable bowel, chronic fatigue, lupus, and RA. So, the other part of this, 90% of people report low back pain, neck pain, or shoulder pain. So, you're going to start to see, again, a lot of other symptoms with these diagnoses. A study from Alabama found that the underlying cause of fibromyalgia may be, stick with me on this, may be reduced blood flow to the parts of the brain that process pain. They also have twice the normal level of a brain chemical known as substance P, which helps our nervous system send pain messages to the brain. Serotonin deficiency is one of a hypothesis and may also explain some of the observed findings, as serotonin is a neurotransmitter which primary role, or one of the roles, is to regulate deep restorative sleep and interpret painful stimuli. Tryptophan is an essential amino acid and is also the metabolic precursor to serotonin. So when we look at all of these, if those get out of whack and we're not getting the proper information, again, that nervous system is super important and what we talk a lot about here in our office, that if that's not functioning the way it should and we're sending mixed signals or not enough signals, then we can end up with that imbalance. So this whole funnel kind of analogy that I gave earlier, explaining how the breakdown of muscle or breakdown in the function of muscle can lead to, again, that individual who's depressed, not motivated, highly fatigued, anxious, and more or less just stays on the couch because that's all they can do. So when you incorporate all these symptoms and how this works, the breakdown in muscle function causes a breakdown in energy. Our breakdown in energy, then we can't do activities, so we have a breakdown in that. Following a breakdown in circulation because we're not moving as much. Without the movement, we have a stagnation of food digestion, which then inherently means a decreased nutrient absorption. Sluggish recovery, because our muscles aren't contracting and moving a lot. Then we have an emotional breakdown because we're not moving and not doing the things we used to like to be able to do. And again, additional muscle disuse, decreased muscle function that continues to spiral down. So, if you look up fibromyalgia, the classic diagnosis that you're going to hear is extremely painful tender points of the body, 11 out of 18 symmetrical points, and that typically is the classic, well, what do you look for? Now, there was a Nobel Prize winning scientist. His name was Dr. Roger Sperry. He stated that 90% of your brain's daily activity is involved in position of our body against gravity. So we're already thinking of, poor posture in the presence of gravity makes for a terrible and degenerative or destructive combination to our spine. Therefore, to eliminate compromise of our nervous system and therefore all organ systems of the body, spinal posture in every point of our day is critical. So, you hear us in here talk, one of the first things we always check on patients is our posture. We check it at every reevaluation. We want to make sure our shoulders are square, our hips are level, feet, arms, everything is equal. Any deviation from that, so again, when I talk about desk job ergonomics, the curvature of your cervical spine, your thoracic spine, your lumbar spine, all those play a super vital role in multiple things, primarily how's our nervous system functioning, but long time, abnormal wear and tear is going to destruct it sooner than it should. And Dr. Sperry concluded that as well. So once the cycle begins, it seems to continue to fuel itself, which I just referenced earlier in the spiral down effect. So what do you need to know, and what are things that you can do to improve this diagnosis? Well, number one, and every patient who has fibromyalgia that we discuss this with, number one is making sure your family and your friends understand the significance of this diagnosis. The number one thing they have to understand is that little improvements along the way matter most. This could take a year, 2 years to come back from. And understanding, the example that I reference, if it's hard for you to walk 30 yards, it's an accomplishment if you can walk a yard. Then maybe next week it's 2 yards. Those little wins stack up over months and years of progression and consistency. Some of the research to this: postural training should be the first part of a treatment program for myofascial pain. That was from medical doctor Janet Travel. 60% of patients with fibromyalgia in 2000 experienced moderate to great improvements with chiropractic adjustments. Reference was the JMPT. 45.9% of fibro patients in 1986 experienced moderate to great improvements using chiropractic care and treatment of myofascial pain. The American Journal of Medicine. All of these benefits without the intoxicating, destructive side effects of prescription drugs. So, things, if you know somebody who has fibromyalgia, maybe yourself, have your spine checked. Let's look at our posture. Let's look at possibly chiropractic adjustments. Let's try to get movement along the way, and then also involve your team, your support system, your friends, your family, your significant other, your kids, those around you who can uplift you and make little improvements. These are the things that we need to know about something such as fibromyalgia. Starting with something very simple, without drugs, without medications, surgeries, injections, starting very conservative, which is our goal here, and then continue to be consistent throughout your care. So, I hope you learned a few little pointers about this diagnosis called fibromyalgia. Again, like us on or subscribe on YouTube, like us on Facebook, follow us on these spinal workshops and on these trips throughout this year. Also, be on the lookout for additional content that we are going to continue to post. I hope you have a blessed day, and we'll look forward to seeing you soon.